Getting patient's temperature, pulse rate, respiratory rate, and blood pressure. Okay. Hello ma'am, I'm Roma Olanid and I'm here to assist our in-house nurse. I'm here to check your vital signs. So you are Miss Martina Perez, right? Let me just confirm the information you filled up earlier. Your birthday is March 22, 1972. And now you are 50 years old. Can you recall when and what is your last blood pressure?
120/80.
Um, how are you feeling right now?
I have a headache.
Can you rate the pain from 1 to 10 is the highest? So the normal body temperature of a person varies depending on gender, recent activity, food and fluid consumption, time of day, and in women, the stage of the menstrual cycle. Normal body temperature can range from 97.8 degrees Fahrenheit or equivalent to 36.5 degrees Celsius or to 99 degrees Fahrenheit equivalent to 37.2 degrees Celsius for a healthy adult. A person's body temperature can be taken in any of the following ways. These are by orally, rectally, axillary, by ear, and by skin. Body temperature may be abnormal due to fever or high temperature and hypothermia for low temperature. Firstly, disinfect hands with rubbing alcohol. Now I'm going to use a digital thermometer to check the patient's temperature by her axillary. Wait for about 30 seconds and off till you hear the thermometer's beeping sound. Now that you hear the beeping sound, check the result and let the patient know her temperature result. Now after using the thermometer, use some cotton balls and alcohol to disinfect before storing. Now let's move on how to check the patient's pulse rate. So the pulse rate is a measurement of a heart or a number of times of heartbeat per minute. As the heart pushes through the arteries expand and contract with the flow of the blood. And taking a pulse is not only to measure the heart rate but also can indicate the following: heart rhythm and the strength of the pulse. The normal pulse for adult ranges from 60 to 100 beats per minute. The pulse rate may fluctuate and increase with exercise, illness, injury, and emotions. Females ages 12 and older in general tend to have the faster heart rates than do males. Athletes such as runners who do a lot of cardiovascular conditioning may have heart rates near 40 beats per minute and experience no problems. Using the first and second fingertip of your hands, press firmly and gently on the arteries until you feel the pulse. Begin counting the pulse when the clock's second hand is on the 12. Count the patient's pulse for 60 seconds or 15 seconds and then multiply it by 4 to calculate the beats per minute. When counting, do not watch the clock continuously but concentrate on the beats of the pulse. If not sure about the result, ask another person to count for you. Now after knowing the patient's pulse rate result, do not remove your fingertips on the patient's artery and continue checking the respiratory rate, because there are cases that patients are changing their ways of breathing upon knowing that they are being checked. Respiratory rate is a number of breaths of a person takes per minute. The rate is usually measured when a person is at rest and simply involves counting the number of breaths from 1 minute by counting how many times the chest rises. Respiration rates may increase with fever, illness, and other medical conditions. When checking respiration, it is important to also note whether the person has any difficulty of breathing. While respiration rates for an adult at rest ranges from 12 to 16 breaths per minute. Now write the result of pulse and respiratory rate on patient's record. Let's move on getting the blood pressure of the patient. Two numbers are recorded when measuring blood pressure. The higher number or the systolic pressure refers to the pressure inside the artery when the heart contracts and pumps blood through the body. The lower number or the diastolic pressure refers to the pressure inside the artery when the heart is at rest and is filling with blood. Both the systolic and diastolic pressures are recorded as mmHg or millimeters of mercury. Normal blood pressure is 120 over 80. Elevated blood pressure is 120 to 129. Stage 1 high blood pressure is 130 to 139. And stage 2 high blood pressure is 140 over 90. Make sure that the patient is relaxed or at rest at least 5 minutes before taking the measurement. Now, after the pulse is located and secure the cuff may be marked with an arrow to show the location of stethoscope head. The lower edge of the cuff should be about 1 inch above the bend of your elbow. Make sure that the fabric fastener of the cuff is snug and secured but not too tight. Hold the pressure gauge on your left hand and the bulb in your right. Close the airflow valve on the bulb by turning the screw clockwise. Inflate the cuff by squeezing the bulb with your right hand. You may hear the pulse in the stethoscope. Watch the gauge and keep inflating the cuff until the gauge reads about 30 points mmHg above your expected systolic pressure. At this point, you should not hear the pulse in the stethoscope. The first heartbeat as you slowly release the pressure on the airflow valve. Note the readings on the gauge as the systolic and the last beat is the diastolic. Allow the cuff to deflate and record the patient's blood pressure. Don't forget to disinfect the cuff after using. Keep your health monitored. Be safe. Thank you and goodbye.